Welcome to Health Advocates Ask the Expert series, our monthly show about trending topics in healthcare. I'm your host, Courtney Preiser. Today, we're joined by Dr. Abbie Leibowitz, Chief Medical Officer and founder of Health Advocate, to talk about second opinions and available programs to help employees navigate this process. Thanks so much for being here.
Thanks, Courtney.
To start with, when is it recommended or appropriate that employees seek a second opinion?
People can get a second opinion anytime they want it. We think of second opinions as the kind of thing to do when you've got a serious, complex, life-threatening condition. But people who have tennis elbow, who go to a doctor and the doctor says, well, maybe you ought to try physical therapy or have surgery or whatever, often say, gee, maybe I'll get an opinion from another guy or another lady. So the patient decides when they want a second opinion.
Okay.
Now, turning that around, if you said, when should people get a second opinion, that's a little different. I don't think anybody should face a life-altering event without getting at least another opinion about how to treat it. So certainly in cancer cases, certainly with people that have complex medical conditions, when there's a diagnostic dilemma, when nobody's really comfortable that they know exactly what the patient has and how to treat it, those are clearly times that you want another set of eyes.
Absolutely. It helps to just feel confident in the decision.
Yeah, and a lot of times doctors will suggest to the patient that maybe we ought to get somebody else to look at this. You know, people don't realize how broad the scope of second opinions can be. They tend to focus on the very high end of very sick people, and certainly that's important. But just going to a primary care physician who says, yeah, I think you ought to see an allergist for this. I mean, basically the allergist is giving you a second opinion.
Sure.
The primary care physician said, I think you've got allergies. We ought to see somebody else about treating this and handling it. So it's a very common process. People deal with it every day. You don't always think of these things as second opinions, but in our world, helping people access care is really the dynamic that we work with.
Absolutely. So why is it important that employees have access to resources or a program when they're navigating this process?
Yeah, it can be confusing.
Sure.
You know, you want to make sure that the person who's giving you the next opinion is a little more expert than the person who gave you the first opinion, because the truth of the matter is that if the two opinions differ, all you have is a tie. So maybe you need a third opinion or a fourth opinion, or this just goes on. You want to try to reach a point of comfort with the physician that you're seeing, with the things that she's telling you, with the experience that she has and that she can call on. A lot of this is iterative. It kind of goes step by step by step, and you just have to work your way through the process. It can be daunting, though, especially if you're a patient with a chronic condition, a serious condition, facing the dilemma of how to get treatment. You need help, and that's the kind of help navigating that whole system that Health Advocate can offer.
That's great. So what is the value of these programs for the employers as well as for the employees? So
the employer has a lot invested in their employees. Obviously, from a productivity perspective, keeping people healthy, keeping them at work is the fundamental goal. Yeah. And when you look at the ability to get to the right care at the right time, everybody believes that that's the most effective way to use the healthcare system. It's probably the most effective way to keep people at work, to get people well. It's got to save money. So the employer is invested in getting people access to best care, and working their way through the system is just part of that.
Improve the care, but also get better costs for everybody.
Yeah, and people at work, people who are not only at work but able to work well.
Yes.
That's a big factor in any business.
Makes a big difference. So how are these second opinion support programs evolving to meet the needs of organizations and the individuals that use them?
We see it a little differently.
Sure.
We see second opinions as part of the care continuum, as part of the approach to population health, to employee engagement. We look at it across the family, so it's not simply the employee, but it's your mother, it's your wife, it's your husband, it's your child. So there's a breadth to this that we take on that's a little different than what other people are doing. But people have carved out businesses around second opinions, recognizing that it's an important part of medical care. We just don't think that it stands alone that way. We think that it needs to be integrated into the entire approach. There's a case management aspect, there's a coverage aspect, there's what do you do with the bills afterwards, how do you get the follow-up care? What if they recommend that you have to travel to another location to get treatment? Those are all things that we do in the course of our usual day at work. So we think that there's a big value in handling things a little differently than some other people do.
More of a holistic view of the process.
Yeah, you have to look at the whole person and the whole circumstances of their life.
Right.
There are a lot of people who really think care is limited to the hospital around the corner and the physicians that work there, and they don't realize that it's a very big country and lots of doctors and lots of expertise. And in almost all circumstances, health coverage covers second opinions. So people have to be made aware and educated about the availability of getting somebody else to look at this.
Sure. So you touched on this a little bit, but what is unique about Health Advocate's approach to second opinion and the support for it?
Well, so it fits into our whole model. It fits into the way that we engage individuals in trying to pay attention to their health. We want to make them aware of the fact that second opinions can be very helpful. We also want to facilitate that. We want to make sure that we can help you get there, that we can identify experts for you, we can arrange the appointments, we can get your records transferred, we can coordinate testing in advance. There are a number of people who opt for chart-based reviews rather than face-to-face visits, although most of the time people want to see the physician directly. But it's absolutely true that for a lot of diagnoses around chronic needs and specific problems, it's entirely appropriate for a physician to look at your medical records, look at your imaging studies, your MRIs, your CAT scans, look at any lab results, look at pathology specimens, and pretty well come to an opinion about what might be a course of treatment for you. So we also offer access to some of the greatest physicians, most experienced doctors in the world who can look at your records and render that kind of second opinion. So that's another part of our program.
That's great. Well, this has been really informative. Thank you so much for joining us.
Oh, it's been great. Thanks.
Thank you. And thank you for being here. If you like what you just heard, you can follow us on our social media pages or subscribe to our channel below. And join us again next time for another edition of Ask the Expert.